Namaste. Today I will be talking about Prameha, which is also called as diabetes. Even though Prameha is much wider term used for diabetes. So Prameha is defined as Prakarshena Avilam Mutram iti Prameha. That is when the patient passes excessive or huge amount of urine, which is turbid in nature. Prameha Rogi will feel exhausted and will feel tired easily, will have excessive hunger, excessive thirst, will have tingling sensation in the legs and the upper limb, will also complain of sudden weight reduction in the body. So generally what happens in diabetes is whatever food we eat, the glucose is produced and it flows in the bloodstream, it reaches to the pancreas and it gives a signal to the pancreas to produce insulin. Due to the derangement of the pancreas, the sufficient amount of insulin is not produced, which is required for the digestion of the glucose, and therefore the glucose circulates again in the body. It goes into the cells and accumulates in each cells. And so how to detect diabetes? Some of the blood tests like sugar glucose fasting is done, in which the normal value would be between 80 to 100, and sugar glucose PP is done, which is done after having meals after 2 hours, and the normal value should be below 140. Then HbA1c is done, for which the normal value should be 5, and also another test like glucose tolerance test is done to diagnose diabetes in early stage. So what we do in VCC Ayurveda is we give importance for the metabolism. Metabolic correction is done. So in which the treatments like Takradhara, Shirodhara is done. Even with the first sitting or the second sitting of the session, we have find drastic improvement in the sugar glucose level in the body. And also cellular level digestion is very much essential. So treatments like Abhyangam, that is massage with medicated oil is done, and Udvartan, that is medicated dry powder massage is done for obese people. And insulin herbs are given in form of decoctions, tablets, churnas. And also one of the major important factor for diabetes is to do regular walk. So a walk for around 45 minutes is very much essential for diabetic patients. So gradually to start the walk, the person can walk for 10 minutes and gradually increase for another 10 minutes the next week and so on. So daily walking for 45 minutes is very much essential, as the glucose which is present in the bloodstream gets converted into energy, and therefore it helps in lowering the glucose level in the blood. And also diet is very much essential. So instead of taking heavy meal, taking small meals like 6 meals a day is very much beneficial. Taking breakfast between 7 a.m. to 8 a.m. and that too having oats or poha, anything which is light has to be taken, and more preference should be given to wheat rather than rice, as it is having less amount of carbohydrate, and also a particular oil is present in the wheat which is very good for eyes, as a diabetic patient can suffer from diabetic retinopathy or such diseases. And also meditation is very much essential, because stress level can directly increase or cause fluctuation in the sugar glucose level of the. So meditating for 20 minutes daily is very good for the diabetic patient. And some of the home remedies for diabetes or Prameha is taking 1 teaspoon of methi seeds and soaking it overnight in 250 ml of water, and drinking the water on empty stomach is very beneficial. And then taking few tender leaves of mango tree and boiling it in water and taking it on empty stomach is very good for diabetes. And also applying oil daily to the food. It can be coconut oil or olive oil is very beneficial for diabetes, and it also prevents from diabetic neuropathy or retinopathy. So stay healthy, eat healthy until we meet again with another health topic. Thank you.